Okay, ladies and gentlemen, this is another episode of The Controversial Room. As you all know, I'm Prince Ewuze, the host of the show. And right beside me, we have a doctor today, and he will be the one to introduce himself. Doc, you're welcome.
Thank you so much, Prince, for this wonderful opportunity to be here to speak on a very crucial and important topic. My name is Victor Ezugwu, and I'm also the founder of Ezugwu Group, which is a conglomerate of Special Medics, Ezugwu Tech, Evo Media, and Ezugwu Health 360. So on today's show, I'll be speaking on a very, very important topic, which our host is going to introduce us to very soon. Thank you so much.
Yeah, thank you so much. It's like I said before, it's an honor having you here. So thank you for coming. All right, before we dive into today's topic, I want you, our viewer, you that is watching us today, hit the subscribe button and the notification bell for you to get our updates when we upload on YouTube. So back to the topic of the day. Dr. Victor, we have an interesting topic, also kind of common to people, which I want you to enlighten people, even to the layman understanding, which is infertility. You know, when it comes to infertility, it's always about the women. It's not about the men. So I want you to clarify that so that people can understand.
Okay, thank you so much, Prince, for this wonderful topic you brought to your platform. It's really an educative one, an interesting one, and we hope to see more of this in your platform. So, you know, in the society we find ourselves, most blames are always ascribed to the female gender. And in the Africa setting we find ourselves, you will see that when the issue of infertility comes up, you will see all fingers pointing towards the female or the women gender.
Yes.
And they fail to understand that this is a partnership problem. It's a couple problem. It's not a problem of one person. And the problem is because most people don't even know what the meaning of infertility is all about. So before we even dive in towards who is responsible for infertility, we need to know what the term means. You understand?
Okay.
So we are going to break it down into simpler molecules that anybody can understand, or a layman can understand, as you said from the beginning. So the question begs, what is infertility? So infertility, as we all know, is the inability of a couple to conceive a child after several series of having unprotected sexual intercourse. You understand? And it is divided into two.
Okay.
We have the primary infertility and we have the what? Secondary infertility. Now, I would not want to speak too much grammar here. Now, the primary infertility is when you have a couple, for instance, they've never given birth to a child. So when you have a couple that has not given birth to a child, after a series of 1 year having unprotected sexual intercourse. So when you see a couple newly married and after 1 year of having unprotected sexual intercourse, they did not conceive, that's primary infertility. And sometimes if the lady is above 35 years old, the number of months is no longer 12 months. It's now what? 6 months. You understand? So we use age to define it as well.
Okay.
So we can say inability of a couple to give birth to a child or to conceive of a child after 12 months, having regular unprotected sexual intercourse. Then for 35 years old is now what? 6 months. So when the lady is above 35 years, now what? 6 months. So this one is for primary infertility. Now these people have never given birth to a child. So, but when you talk about secondary infertility, this one is very, very common. You will see maybe some couples, after giving birth to first child or even second child, after 12 months or 1 year, they find it very difficult to give birth to another child. So that one is now what? Secondary, because they've given birth before. So we've now we've defined infertility and been able to differentiate it from primary and what? secondary infertility. And I know for sure our viewers here now, or for those that are having this issue, will know where they belong in and do not know how to sort it out. You understand? So the question now comes, who is responsible for infertility?
Exactly. I was about asking you that.
Who is responsible for infertility? Remember in the definition, I said is the inability of a couple giving birth. So we are dealing with two people here, not just one person. Because in our society, we believe that for anybody to give birth to a child, they should be married, right? So that's why I'm using the term a couple, you understand? So it's not a one-way process, it's a two-way thing. It involves the man and involves the woman. And according to statistics, both the man and the woman, they play almost the same role or the same percentage towards infertility. Some data will tell you that men contribute 40 to 50%, and women as well contribute around 40 to 50%. Can you see the data? They are very, very close. So it's not like saying women contribute 80 and men contribute 20, the way we see it in the environment we find ourselves. So both the man and the woman, they contribute almost the same percentage, and sometimes the remaining percentage might be due to some factors that cannot be explained. You understand? So we are now going to look at probably the factors that can cause this infertility in males and the factors that can cause this infertility in what? In females. Because that's the main aspect I want to dive into. Now, I'm going to start with the female factors. Then after that, we'll now go into the male factors. Now, for the female factors, they are grouped this way. As I said, I want to break it down. So the first one, they call it the ovulatory factor. You understand? That's the ovulatory factor. That's ovulation, which is common. We hear that word ovulation all the time. So most, a woman has a cycle length. Most times it's 28 days. You understand? But according to science, the normal cycle length is from 21 to 35 days. So it does not mean if a lady's cycle length is 22, that is not normal, because we're always conversant with 28 days. So normal cycle length is actually from 21 to what? 35 days. Yes. Wow. You can do it 28 plus 7, 28 minus 7. You understand? So most times, some women, they don't have this normal cycle length. It might be less than 21. It might be greater than what? 35. So that is the ovulation factor. There are many other ailments inside this ovulation factor that I will not want to mention because it's of no relevance to the listeners. They are big names. Like there's a one they call PCOS, polycystic ovarian syndrome.
You can break it down.
So the PCOS is actually under the ovulatory factor, where you see some women, you see their cycle length might be more than the 35 days we are talking about. Are you understanding now? So, and you see it has qualities that when you say a lady with PCOS, you can actually tell that this lady has PCOS from just mere observation. They call it maybe mere physical examination. You just look at the patient first. You've not done any test. And there are some things you just
so what are the basic symptoms? Can you give
those signs, the basic ones you can see most times. Most ladies with PCOS, most of them or some of them are obese. They have obesity. You understand? And one striking sign is you see them growing hairs, side beards. As a female, normally female is not supposed to have those beards because it's normally found in males. So you see them having side beards. That's a striking feature. And even you see them having pimples and the rest. So these are the major signs. But then you have to do some tests to confirm. But these are just things you can see as a medical doctor. When you see your patient, you can be having some clue that this person might be having this particular issue. So these are examples of the ovulatory factor.
Factors, yeah.
Another one is the tuber factor.
Mm.
You know, women have what they call the fallopian tube.
Yeah.
The fallopian tube is a tube structure. It connects down to the womb, what they call womb. Science call it the uterus, where the baby stays. And fertilization occurs in that fallopian tube. You see why the fallopian tube is very, very, very important.
Yeah.
Okay. So the first one we talked about, which was ovulation, ovulatory factor. I said there's something they call 28-day cycle, which is normal to cycle length, 21 to 35. And inside this 21 to 35, if you subtract 14 days, from this cycle length, you have your ovulation day, where the lady releases egg.
Yeah.
You understand?
Okay.
So because maybe some of them don't have this normal cycle length, they might not be releasing those eggs as at when it's supposed to be released, which will not cause infertility.
Okay.
That is for that ovulation.
Yeah.
Now I want to link it now with this tuber factor. Now, even if the lady has a normal cycle length and the eggs are being released at when that's the ovulation period. Now, when the eggs are released, and even when the sperm comes to fertilize the egg, the tube might be blocked. You know what they call tube is like a pipe. The fallopian tube is like a pipe.
It's just like a pipe.
Yes. And if maybe you take a hose or a pipe, you use your hand to clench it like this, you see that the water might not flow.
Yeah.
It will be very, very difficult. So the fallopian tube, when the fallopian tube is constricted, when it is narrowed, because it's not supposed to be too narrow, it's supposed to be opened. Right. So when it is narrowed, if maybe this is my fallopian tube now, and it is not narrowed like this, you see that even the sperm cannot pass through to fertilize the egg. And even if it is being fertilized, implantation cannot occur. The zygote cannot even move. You see the problem now. Yeah. So that is a tuber factor.
Okay.
You understand? And how do people get this tuber blockage?
Yeah.
How people get this tuber blockage might be number one. There's something they call PID.
PID.
Yes, I don't know if you've heard of PID, pelvic inflammatory disease.
I'm not medical.
Okay, so you know why I ask, because it's a common disease or infection. We see it among young people today.
Wow.
You know,
is it on women's side or both genders?
It's normally found on women. You understand?
Is there any possibility that a man can also have it?
You know, the reason why we call it pelvic inflammatory disease, you know, you can get it from men, but men do not have a fallopian tube.
Yes.
They do not have uterus where those organisms will go and cause damage. You understand? That's why it's mainly prevalent in women. Because what happens is that when some ladies engage in unprotected sexual intercourse, they can get these diseases from men. You understand? And when these diseases or this organism, they can ascend up. When they ascend up, they go to that fallopian tube and block it. They cause damage there. So when it's being blocked, you observe that the sperm cannot pass through. The fertilized egg cannot pass through that fallopian tube. So any lady that always undergoes an unprotected sexual intercourse, there's possibility that a tube might be blocked.
Wow.
You see it now, and that will now lead to what? Infertility. So apart from PID,
so how do you prevent it? You said through PID.
Yeah. The way you can prevent PID is through abstinence.
Okay.
It's through abstinence, and for those who cannot abstain, what do we recommend? Always use protection.
So what if you are a couple?
Okay.
And probably your husband, you might not know. Maybe your husband is.
That is the problem, because we've seen cases in the hospital.
Yeah.
Where a woman is trying her best. Maybe a couple is having this fertility issue, and the woman is trying her best to conceive, but the man is acting as a weapon fashioned against the woman, because the man is not staying in one place, he's moving from one place to another, having unprotected sexual intercourse with other women outside. Then from there, that man cannot infect the woman.
The wife.
So what we advise is, if you are a lady, you observe that kind of thing,
Mm.
you can talk to the husband and inform him about the implication of what he's doing, because your life is very, very important, and if he does not desist from it, is better you as a lady don't have any intercourse with him without protection,
even when married.
Because I'm talking based on life, because your life is at stake. PID can kill someone. You understand? Because it's a bacterial infection. It can destroy someone's womb and cause other damages in the person's body.
But when a woman kind of contracts PID, are there any kind of vaccine that can be able
so
to
when a woman has PID, because there are some symptoms that it will present with, you understand? So when the lady begins to present with symptoms, one of it is you see the lady having a lower abdominal pain. You know, the fallopian tube is located at that region. So start having abdominal pain, start having fever.
Constant fever.
Yes, start having fever. So the person should go to the hospital. If you present with any of these symptoms, the person should go to the hospital. Go to the hospital and see a doctor, so that they will run an examination on you and also do a test to confirm that it is PID. Then treatment will now will now follow up.
Okay.
You understand?
Yeah.
So that is how we know. But the best thing, what we advise couple, don't cheat on your partner. Try to be faithful to your partner.
Okay.
Because you might be saying you are looking for a child, and you, like the man, see the way the man now is not contributing
to the woman's.
You see now. So some people that are ignorant now, they will have a cheating husband, and they begin to blame the woman. Meanwhile, the husband, everybody knows the husband is cheating. Is a cheat, a good cheat, 100%. Everyone knows about that. But the family will continue to blame it on the woman. That is ignorance. That is why we are here.
Yes.
To enlighten us.
Exactly.
That a woman might be trying her possible best to see that she conceives, but the man is at a particular corner trying to cause asunder, because he does not want to stay in one place.
Okay.
You understand?
So moving on, in terms of women infertility.
So we've talked about the ovulatory, that's the tuber. You see, you are following. Then the third one is what they call the uterine factor.
Okay. That's
the womb factor. So this one is occurring in the womb. Like for instance, number 1, fibroid. But it's not all there are different types of fibroids. So when we say fibroid, we are actually looking at one type, which is the submucosal fibroid. That's what they call it to Igbo people in science.
So there are
different type of fibroid. It's only the submucosal fibroid that can lead to infertility. Okay. So if anyone comes and tell you fibroid can give infertility, it's not true.
So one can have
fibroid and still give. Yes.
Wow.
One can have fibroid and still conceive and still give birth.
It
depends on the type of fibroid. So that's why you need to, if maybe you see maybe a swelling in the abdomen, you need to go to the hospital, so they will run a physical examination and know the type of fibroid you have, to know if it's going to affect the person's infertility or fertility. You understand? Okay. So not all types of fibroid. That's the misconception people have when they hear people have fibroid. Hey, I cannot marry this lady, or this lady has fibroid.
She won't be able to.
You understand? And stigmatization. So that depends on the type, which is submucosal type of fibroid. Okay. So that is the uterine, one of the uterine factor. Under that uterine factor, there are some ladies that maybe have undergone abortion when they were young. You understand?
Yeah.
And during that abortion, there are some of them, they go to quacks. They meet quacks. And when the quacks, they do some procedures. There are some procedures they do, they pass through the birth canal. And those procedures, they might cause damage. If maybe you have a wound in your skin, this is my skin. If maybe I have a wound in my skin, after some time, it will develop something like a scar.
Yeah,
you see a scar, maybe something that is fibrous. So that's maybe that kind of thing might happen in the womb where the baby stays, and you injure the womb. The injury heals with time. It then develops something like a scar.
Yeah.
Remember, the womb is where the baby stays.
Yeah.
So even after the baby is being formed, the baby can no longer implant. It can no longer hang on the walls of the womb because of the presence of that scar. Because the scar is not supposed to be there. That's not the way God created it. You understand? It's supposed to be maybe smooth, but now you're not having scar everywhere. So the baby will not see a place to implant very well. You understand? So that might be another factor inside the uterine, that uterine factor. And sometimes under that uterine factor, there are some congenital problems. There's a problem that occur during birth. There are some, the uterus is just one. There are some people that have two.
Really?
Yes.
Well, is it that when they have two, they kind of God create it?
That's why I say
working.
No. It's two in the sense that it might be one like this, and to not divide like this, something like this. Not two. It's not supposed to be like this. It's supposed to be like this, and now comes the baby cannot implant very well.
Disadvantage?
Yes, it can cause infertility because the baby cannot implant within the natural place. It's supposed to be open, just one like this, but it's not like two. So this is another uterine factor that can cause this particular infertility. So we've looked at the first one because I want all of us to go follow. You understand?
Yes.
We look at the first one, which is ovulatory. We look at the second one, which is
fallopian.
there, which is tuber. And we looked at this other one, which is uterine. Now, another one again is the cervical factor.
Okay.
The cervical factor. There's a woman has what there's something they call the cervix. You understand? After the womb, as the womb is coming down like this, there's something they call the cervix. The womb, that's which leads to the cervix, where the baby will come out. From that cervix, you get down to the birth canal, which they call the vagina. You understand? So that cervix is like a passageway for maybe sperm or semen to pass through and go to the fallopian tube. So sometimes it's closed. They call it cervical stenosis. Cervical stenosis, when the cervix is closed, the sperm cannot pass through to fertilize the egg. You understand? Even infections can also block that particular area. You understand? So cervical stenosis is that cervical factor is also another issue that can cause fertility. There's also another one they call maybe peritoneal factor. So this peritoneal factor, it can be maybe there's something they call endometriosis. It's a big word. Understand? But all these things they come with, you see a lady having maybe every time the lady is going through is on her period, she will have excessive pain. Even when she takes drug, it does not subside. You understand? And you see bleeding, like excessive bleeding. You understand? So it can be endometriosis, and the other big names that I will not want to mention here. You understand?
I want to ask you, in all that you've mentioned, are there any way, in case of anyone that have a case, a similar case, or like all these ones you've been mentioning, are there in any way that, are there any, is there any cure for it?
Okay.
Or once it's happened, that's it.
Okay. So they have all these things we are saying. They have cure.
Okay.
You understand?
It's just for you to understand what the problem is.
Yes, because if you don't know what the problem is, you don't know how to approach it. So that's why I want to use this medium as well to advise our viewers. Don't joke with the hospital. We do neglect the hospital.
The hospital a lot.
So when we have issues, we'll go on and try somewhere else, or doing things that we're not supposed to do. We neglect the hospital where we meet experts. When you go to the hospital, you meet experts, and they will look at your case and identify where the problem is coming from. Because this is a sensitization platform. We're not actually here to treat anybody. Because for you to treat someone, you take history from that patient, detailed history from that patient. You examine that patient very well before you can even come to a diagnosis after a series of investigation or tests you've done. And what you do for A might be different from what you do for B. So that is why when you look at these symptoms and these signs we've discussed, like someone now will say, my cycle is no longer 21 to 35 days. So I should report to the hospital. So that they will look at it. Because anything you detect on time, you can salvage it.
Yes.
You understand? So, but we Nigerians, we see hospital as, I don't know, we see hospital as a place where it is very, very expensive, or they feel it's not even necessary. Yeah?
Yes.
So it's not even necessary. You understand? So that is for that. Okay?
So when it comes to men now.
So when it comes to men, I think that is the place I really want to
talk very well on.
You understand? Because a lot of our ladies have been victimized and stigmatized, even in the family. And and they don't even know that men contribute a whole lot to infertility. You understand?
Yeah.
Number one, you will see some men, their lifestyle, even lifestyle is also lifestyle modification, lifestyle changes in women so that can cause infertility. I just want to start from that. The lifestyle of some men, there are some that drinks a lot. They drink alcohol too much. If you drink alcohol, you smoke, you are at the risk of having infertility. Because one of the things that can cause infertility, because let's take a look at what actually fertilizes the egg. You know, if you take a look at the male reproductive structure, you observe that there's something they call the testis. It's found in the scrotum. So that testis is responsible for the production of sperm, which fertilizes the egg. And there's a whole lot of things that happens there. That at the end of the day, what comes out is not even the sperm alone. What comes out is what they call semen. And the semen contains the sperm itself that fertilizes the egg, and it contains all other nutrients that will make that particular process a success. You understand?
Yeah.
So this sperm, it has a proper shape. You understand? It has a normal quantity. It should be.
It must have a proper shape.
Yes, it has a proper shape, and it has a normal quantity that must be there for fertilization to occur. You understand? And also the shape, they call it the morphology. And also there's another one they call the motility, how it moves. You understand? So you see that most men that smokes, that takes alcohol, is either the alcohol or the smoke will reduce the quantity of the sperm. That's what we call oligospermia. The sperm is not less than, for a sperm to fertilize the egg, it must be in millions.
Yeah.
You understand? So, but when you take alcohol, you take alcohol, you smoke, you are reducing the quantity of the sperm. And this is what most men engage in. I can say for sure, most men they do smoke and drink a lot. Some will say, I know this particular person that used to smoke and drink. He has given birth to 5 children. But they fail to understand that everybody's system are not the same.
Yeah.
You might think that this person is like this. Like, you don't even know the amount of cigarettes this person takes, or you don't even know the amount of alcohol this person takes, and you don't even know the kind of body that this particular person have. So we are not going to say that because it's not happening to this person, it cannot happen to you.
Yeah.
So everybody needs to be very, very careful. And secondly, there are some studies that says there are some men that when they were growing up, they had some infection. They call it mumps. So one of the questions we normally ask are couples, mostly the men, when they come for infertility check. That's when we were growing up, did you have any form of mumps? Because that mumps can damage the testis, and it will not be able to produce the sperm that it needs to be produced. So that one is infection aspect.
That mumps, can you please kind of break it down?
Okay. Yeah. What I mean is that this mumps is an infection that a man can get during childhood.
Okay, infection.
Yes. So it's an infection someone can get during childhood, and if maybe this person was not properly vaccinated for it, or was not properly treated, and maybe they did not notice it on time, it can destroy the testis. Do you understand? It can have an effect on the infertility of the man as the man is growing up. So that's the question we normally ask patient. We say, okay, you as a man or your husband, has he told you before that he has mumps? MUMPS. You understand? So that is for the infection aspect.
Yeah.
And sometimes some men, they do wear or put on tight boxers.
Wow. So it can also cause.
It can cause infertility.
All these banana boxers, stuff like that.
Tight boxers. Because if they look at the position of the scrotum anatomically, God positioned it in a particular environment because the sperm is sensitive to temperature. You understand? So there's a kind of temperature you expose the scrotum to, and it will destroy the sperm. So that is why the scrotum was placed at that particular location. You see?
But talking of destroying the sperm, like, is it man reproduce a whole lot of sperm?
Yes.
So will it, even the one yet to be reproduced, like, will it still affect it?
the sperm that are being produced, it takes time. You understand?
Okay.
It's not the cause spermatogenesis. Yeah, it takes time. You understand? So those heat, those increase in temperature, it can affect the rate at which that production occurs, because those things need enzymes, and enzymes works at a particular temperature for it to function. So if the temperature is not conducive, the rate at which it is being formed might be reduced, and the quality might also be affected. The quantity will also be affected. So the temperature is very, very, very important. That's why they advise you not to put your laptop. I don't know if you've heard of it. Don't put laptop on your legs, on your thighs rather.
That can cause
because the heat from the system can be transferred to your scrotum.
Wow.
You understand? So these are the things we do unknowingly, and at the end of the day, we begin to blame the woman that she is the cause of the infertility.
Okay.
You see, and another one is that most times you observe that some men, like where I'm going to now, is that you observe that some men, when they are being approached of this infertility issue, they do not want to take responsibility.
They defend themselves.
Thank you.
I'm a man.
I'm a man. You understand? That is ignorance.
My forefathers had so many
8 children, 10 children. They don't want to go for tests.
Yes.
So when as a couple you come with this kind of issue, you should be supportive to your wife.
Sure.
You understand?
You should be one-sided.
You should be one-sided. Don't blame her. Don't tell her that you are the cause for this, you are the reason why you are having this. Support her, because the marriage is a partnership actually. Both of you are together there. You understand? So people should work together and see ways in which you can salvage the situation. Infertility is actually not even a big deal actually if followed the right way.
Okay, Doc, I want to ask, because I don't know how to put in the question, but I hope you will understand. Are there in any situation whereby a man will have an issue of infertility for life? Are there in any situation whereby they say this man can no longer?
Impotent.
Yeah, impotent.
Okay.
Do you get? Whereby are there, because I think they are similar, a little bit similar.
Yes.
So I want you to talk on that.
Yes, a man can be. When I started, I said there are a lot of factors that can trigger infertility in males. Yeah. I talked about the shape. I talked about the quantity. I talked about the quality. You understand?
Yes.
If a man is deficient in any of these qualities I made mention of, a man will find it very difficult to give birth to a child, to impregnate a woman. And that's what we call impotency. There are some men that even when the number of, maybe the sperm is much, they're having a lot of sperm, but the shape of those sperm are not properly formed. Even when the shape is there, the number is there, but it cannot move. It does not have the energy. When the sperm is being released, it needs to move fast to go and make the egg. It cannot move. It is sluggish. You see,
so you're trying to say what can cause it is all like the kind of lifestyles the person.
So kind of lifestyle, and it can also be infection, which I made mention of. It can also be congenital. It can occur from birth. There are some health issues one can have. Maybe the testicle is not properly formed. Congenital problem that occurs from birth. It can make someone to be impotent.
Wow.
But all these things can be. There are ways they can salvage all these situations.
Can be managed.
Yes, even in men. When you for instance now, if a couple is having issue giving birth to a child, whether primary or secondary infertility, both of them need to undergo series of tests. Number one, not just one person. You get, not just one person. And before I proceed, before I forget this, as a couple, if you are a couple is looking for a child, please, let me face the camera and say this.
I beg.
It's very, very important. If you're a couple and you're looking for a child, please, you as the man, be available. Don't tell me you are a couple and you're looking for a child, and you as a man, you are living in Sokoto and your wife is living in Abuja. It does not make sense. Or one is in Nigeria and the other one is in UK. Like how? Like how do you think that will be possible for people to conceive? We've seen cases like this in the hospital.
Really?
Yeah, that you see couples coming for fertility checkup and the rest, and they're not living close together.
Yeah.
The doctor in charge or the consultant in charge will just say, okay, don't you think it is very, very necessary that you come back and stay with your wife for like 1 week during her ovulation period, and they teach them how to do the calculation. Believe me, that after that particular scenario, when the husband came back and they were together for 1 week, 2 weeks, they conceived.
Wow. You see.
You understand? So
Yes.
that's one of the most important things most persons don't know. You can't tell me you're looking for a child and you say it's your work. Is your work more important? That means you're not serious. My consultant will say you're not serious to give birth to a child if you cannot find a way to make sure that you stay very, very close to your wife, or you as a wife, you stay very close to your husband during that particular period. Okay. So if maybe you've undergone this particular advice and maybe you are still unable to conceive, you come to the hospital, they run some tests for the woman and they run some tests for the man. And if maybe after everything nothing is still happening, there are different ways different options. The consultant will advise, the doctor will advise, there are different options. There are now ways.
You can list. You are free to list the options. We are here to enlighten people.
Yeah. There's something they call assisted reproductive technology. You understand? Assisted reproductive technology, where couples are being assisted to give birth to children. There's a popular one that we all know. They call it the IVF, the in vitro fertilization. And should I tell you a secret? Just
fire on.
Okay. One thing about IVF, it's a 50-50% situation. Because what they do in vitro fertilization is that for couples that find it very difficult to give birth to a child, fertilization normally occurs inside, in vivo, but we are taking it outside. We bring the woman's egg, then bring the man's sperm and fertilize, bring them together, reduce the workload of the sperm. So the sperm cannot move. You understand? And we are doing it with plenty of eggs, not just one egg. You understand? Because it's a trial and error situation. You understand? That's why at the end of the day, when you see couples that are looking for children, you see some couples, they've not given birth for like 10 years, but when they give birth, you will see them giving birth to twins, triplets, quadruplets. I don't know if you've seen situations.
Yes, I've seen such situations.
That's the work of IVF.
Wow.
That's the secret. That's the work of IVF for you.
That's very nice.
So you might just give birth to 4 children at once, even 5. You understand? But most time it does not work. We might even spend a lot of money because the procedure is very, very expensive.
Wow.
It's very, very expensive. I would not want to call the amount of that particular procedure. You understand? But it's very, if maybe you want to engage in those kind of things, visit the hospital.
Yes.
You understand? They will guide you. You understand? On how to go about it. But it's an expensive procedure. But if the couple comes together and reason together, they can easily salvage that particular situation. So apart from that, there are other ways. Like there's something they call artificial insemination.
Okay.
You understand? Most times, maybe sometimes you see that the man is not. There's something they call azoospermia. There's some men that does not produce sperm at all. Because azoospermia. It's not like oligospermia.
Like at all. Even when
it does not. There's no. You might see maybe semen though, but you will not see. Semen is very from sperm.
Yes.
But you will not see sperm cell inside the semen. You understand? Sperm is different from. That's all those things we've listed now. Wow. Those things we've listed can be the cause. All those things can cause it. So those lifestyle changes, congenital problem, even the tight boxers and the rest, all those things can.
I go avoid tight boxers.
Can cause it, and for drivers too. Now they. Yeah,
I wanted to ask because I was like, can stress cause a man or a woman being fertile, or maybe I don't know.
The only way stress can cause infertility is when maybe stress leading to what they call in male leading to what I'm coming to female too, leading to what they call erectile dysfunction. Erectile dysfunction can also cause infertility in males. Some people might not know what erectile dysfunction is. Let me break it down. Now, what is this erectile dysfunction? Most times when a man is ready to make love with the wife, it's very, very important that the reproductive organ, which is the penis, it stands erect. You understand? It's erect. You get. And what causes it is that there's inflow of blood. You understand? Blood will enter inside. They don't call blood vessel. You understand?
Okay.
So when blood enters inside that blood vessel, it makes the penis erect.
Okay.
You understand? And if the penis is not erect, ejaculation cannot occur.
Yes.
Ejaculation is what leads to the release of what? Of sperm or semen.
Okay.
You understand?
Yeah.
So because of stress, you know, it's a psychological process. So stress might not make you, you know, there are some men that are going through a lot. That when they even come home, they don't even find their wife. It's not attractive, or it's not even coming to their head. So to have an erection, that's what they call erectile dysfunction. The man cannot have an erection. So I've broken it down. So when I say erection now, you know what I'm talking about. Yeah. So the man cannot have erection. Even when he has erection, he cannot sustain it. The one thing is to have it, another thing is to sustain. Understand? So stress can cause erectile dysfunction in males. You understand? So from there now, that is where the stress we're talking about can now lead to infertility. When the man is always stressed out and the rest. So that is one part it can play.
We are talking about driving.
Okay, before I come to driving, for female, stress can affect them to release egg. If the stress is too much, the female can no longer release egg as at when the ovulation is on the 14th day. Yeah. And if you want to give birth to a child, you must have sexual intercourse on that. Maybe 5 days. No, the sperm stays for 3 to 5 days. It's alive 3 to 5 days. So you must have sexual intercourse 5 days before the ovulation. You understand? And maybe and probably 2 days after the ovulation. If it's 28 minus 14 is 14 now. So the ovulation now is on the 14th day. So if a couple wants to give birth, they are serious want to give birth, they must fire down throughout that 1 week. If they really want to give birth, at least
fire down.
Yeah, at least 3 to 5 times that week. You understand? If they really want to give birth to a child. So these are one of the easy ways they can do that. Then for driving, I was thinking about driving. Yeah. It can happen to anybody if you stay in the driving seat for a long period of time.
Like how many hours? Let me know.
Consistently.
Because I kind of some recent days, although I do drive long distance.
Long distance, that's what I'm talking about. So people driving long distance, like all these drivers going to Benin, Auchi, all those interstate traveling. They're always on the road. And you know that seat is very, very hot. I don't know about some other cars. I'm talking about some of those buses, the way they are being made. But maybe due to technology, your own car might be not like that. You don't stay there for long. But I'm talking about people that are into interstate traveling, day in, day out, Monday to Friday, even Sunday. They are always on the road because of the hotness, the temperature of that particular seat. Remember, we said something about temperature. It can reduce the quantity, the quality of the semen and the sperm there. So that is for the driving road aspect. Okay. You understand? And there's also artificial insemination I talked about. I talked about IVF, artificial insemination, where maybe the man
I think you even stopped at IVF.
Yes, I'm come there now. I said the IVF, I've explained it now outside. And I said a secret why how you can know that couples have undergo IVF, even if they will come out and tell you that some might tell you they did not do IVF. But there's nothing wrong. Viewers, there's nothing wrong in doing IVF.
So some people do say my faith do not accept this. I don't know.
There's nothing wrong doing IVF. It's science, and there's nothing wrong because it's still your egg and it's still your sperm. The one that people might find out is the artificial insemination. You understand? Whereby sometimes they might take semen from another person and fertilize the egg. That's what some persons are against because of their faith. But some people might also be against. Like I know some religion that are against IVF. I will not mention any name, you understand? So they are against IVF. But I'm here to tell us that please, for your sanity's sake, so that you not be having issue, it's an option. You understand? It's an option, and for me personally, I don't see anything wrong with it. Because the problem has been solved. It's still your egg, it's still the couple's sperm. It's just you are helping. Just as in our church today, we use mic to help to sing. Is an aid. Yeah, it helps us to amplify our voice. So it's just like an aid to they are doing there in IVF. So if you can afford IVF, you can do it. But if your faith is against all of them, there's also another one they call surrogacy. Many people are also against that one. Yeah, I don't know if you've heard about it. So in surrogacy, it's just that they might, maybe in IVF for instance, they might take a woman's egg, take the man's sperm, fertilize it, forms a zygote, and it's going to form an embryo. The woman might decide to say, I don't want to take this baby, I don't want to carry this baby for 9 months. I want to enjoy my life for 9 months. months. I don't want to carry this baby. Or maybe the woman has problem with the womb. Remember we talked about the uterine factor. There are some people that does not have womb. It might be due,
produce egg now.
Yes, it might be due to maybe some issues, cancer or the rest, on some underlying health issues. Some people they're having issue with womb, and if the baby is dead, it might lead to miscarriage. So they might find someone to carry that baby for them for 9 months until they deliver. So that one is there. So that mother, they call that mother surrogate mother. You can check it up. Yes, understand. So that's surrogacy. So this is another way we can actually use to give birth to children. But some people, some faith might be against it. The another one is adoption.
Adoption.
This one is not even scientific based. Understand? Because maybe you don't. There are a lot of options. So it depends on you, on the individual in question. So you can adopt a child and you train the child as yours. You understand?
All right. Thank you so much, Dr. Victor. So I don't know. We are about to round up. Before we do that, do you have any advice you can give to couple out there, or any other thing?
Okay.
Or even young guys that are yet to get married.
Okay. One thing about reproduction is that in reproduction, mostly in women, to start with, people say age is very, very important. You understand? Sometimes some people want to victimize some ladies and say, your egg is about to get finished, because age factor is also a problem in infertility. Because there's age you will get to, you'll not be able to. That's for women. Your egg will be reduced. You understand? You will not be able to conceive of a child. You understand? But what I would just want to say is that you shouldn't allow, as a woman, you shouldn't allow the age factor to actually bother you, because there are some people that are 20 or 22 years that are still looking for a child.
Yes.
You understand? So the reason why I'm saying this is because of the society we find ourselves. That does not mean that if you have the opportunity to give birth on time, you shouldn't. If you have the opportunity to give birth on time, try to give birth on time. It will help you.
Yeah.
Because according to statistics, most women who are above the age of 35, 40 years, they find it difficult to conceive. And if they give birth to children, the children might have issues. There's something they call Down syndrome.
Wow.
So they are prone. It's not that they will give, but there's something they call, these people are prone to having Down syndrome or having issues or complications during. But there are some people we've seen 35, 40, give birth to normal children. But if you have the opportunity to get married on time as a lady, do well to do that. You understand?
Okay.
And for, again, the steps we've made mention of, please, those factors we made mention of, even the lifestyle, if you know there is any way you can try as much as possible to avoid all those things so that it will not affect us in the future. There are some lifestyle modification I made mention of in the factors, and there are some certain things that it is not caused by you, it's just natural, so you don't need to blame yourself. It's something that is natural.
Just find a way to figure it out.
You understand? You're like blaming a woman that have PCOS. It's not even reasonable. Did the person create herself? You just find a way to support her. And people with this condition, they give birth to children. So you should not victimize anybody. You understand? Same applies to males. You as well can also be the cause of infertility. It's not only the woman. You as a man, you can be the number one problem. So always make sure you check yourself too. So if the woman is going for checkup
and examine your lifestyle,
it's very, very important. Not every time they see you, you're always smoking, you're always drinking alcohol. You drink alcohol during your youthful age, and when you're not ready to get married, you will not be able to conceive, and you start blaming a woman that has been very, very decent all through her life. So you've seen now from everything we've discussed that both couples have a role to play. They are both responsible. We are not pointing fingers at anybody. Both couples are responsible for what? Infertility, not anybody. Even the percentage and the statistics have shown it: 40 to 50% for the man, 40 to 50% for the woman. So we should stop pointing fingers at anybody or insulting someone, telling this person you're a witch, you are this. Instead,
especially all those mother-in-laws.
I'm telling you, it's so annoying.
Man. Why are you married to a man?
It's really, really annoying. Instead, you encourage them, support them, take them to the hospital. We've discussed there are ways you can go about this, and before you know it, they will give birth to a child. So please, even the psychology we talk about stress, you can make them not to give birth to a child. Someone is looking for a child and you're insulting the person.
Say adding to the problem.
Say adding to the problem. Say the person is a witch. You are a demon. You are this. You are eating children, and you expect that person to give birth. So that is it. So please, let's be enlightened that infertility is not a one-way something. It's a two-way. It can occur. It can happen to anybody. It can happen to anybody. So don't say because in my family we used to give birth to 10 children once, that it can happen to me. So you should be very, very careful. And when you observe or you notice that you're having primary infertility, as we discussed, or you're having secondary infertility, please go to the hospital and meet a professional.
All right. Thank you so much, Dr. Victor. It's really nice having you in the
Thank you so much. Yeah.
Thank you. And once again, we would love to have you again.
Yeah.
Because there are so many interesting health topics we need to, discuss.
Yeah.
So, all right, ladies and gentlemen, to you watching us, I don't know why you've not subscribed to our channel up to this moment. This is the last part of the video. So please do well to subscribe, hit the notification bell. So I remain Prince Ezugwu, the host of the Controversial Room. We will see you on our next video.